In front of you. All right, let's keep whittling away here. So what's happening? Hey everybody, it's Dr. Nicole Freels here. I have a case for you that's really, really important. I'm from a small town, you know that. This group in here is too. He's a diabetic and has had wounds on his feet for approximately 4 months. They're really calloused over, and honestly, I don't know what's gonna be underneath. They're so hard and thick. We're actually soaking them right now. So give us just a couple minutes and we'll get you in there. Let's go ahead and get this measured. Thank you. So pre-debridement measurement is...
And you're doing right first?
Correct. So it's sub-fifth metatarsal base, and it is 2.4 centimeters by 1.4. And then we've got one over here. We'll measure that one in just a minute. So let's get our blade on our handle. So this lovely family is also from the sticks, just like me.
Yeah.
So we wanted to do this one to really kind of educate and show people in our smaller towns and communities kind of what to be looking out for.
Sure. That makes sense.
Yeah, so with this one, you said you were thinking it was maybe 4 months, that possibly longer on the right side, and then
Yes.
the left side is newer.
Newer.
Okay,
Yes,
great.
ma'am.
This little blade handle, perfect. Okay, so we're gonna hand this off, Katrina, and I will just need some gauze for, there we go. So you said this was a big blood blister.
Yeah.
And then when did it just kind of fell off recently?
Yeah.
Almost looks like today.
Yeah. Probably last night or so.
I'm gonna raise you up,
Okay.
save my back.
Yes. By all means.
And you haven't been feeling nauseous at all or anything like that? Any nausea,
No.
vomiting, fever? Here went the other one. You know, Katrina, we may want to just throw a pody towel on the floor, because I know that this is going to, oops, sorry. We just don't know how deep this is.
Yeah, I bet.
Okay. So this gentleman is a diabetic
Yes.
with obvious neuropathy. And so we got to get all this cleaned up. And we were talking before we started filming about, and you can just relax your foot. I'll hold it for
Okay.
you. There you go.
All right. I'm sorry.
No, don't apologize. You were trying to help me. I appreciate it. All right. We were talking about before we started filming where he's on Eliquist and the concern for debriding this aggressively. Well, we've got to get the dead skin off, because what happens is it may look like it's closed or a callus, and perfect. But it's necrosing or killing the tissue underneath. Oh, I just need the pody towel. In front of you. All right, let's keep whittling away here. So what's happened, a shoe has rubbed up and put pressure against this. And sometimes it happens just from sitting in a recliner. That pressure, and when you don't have good feeling, you don't know to move your foot.
Right.
So what we have to do, or what happens is the blood accumulates. And that's why you get all this black buildup, and then it just gets really hard and calloused. This is actually looking better than I expected, guys.
Awesome.
Given what we were looking at
Before.
yes. Yes, absolutely.
You've given me a lot of good news today.
That's right.
I appreciate that.
We did look at the x-rays. There is no signs of osteomyelitis or bone infection. And given the longevity and how long this has been here,
Yes.
that's always a concern. And
Yes.
that's why you always want to take x-rays with ulcers to monitor the bone.
Well, I've been fair warned already. I won't let this happen any longer.
You got it.
Yeah.
You're under my watch
Doctor
now.
made your bullet.
Yes, you did. So anytime you have a callus, you know, as a diabetic, and it may not look like much, definitely get
Right.
it trimmed off, because it just turns into an
Okay.
ulcer. And then once that gets infected, the bone can get infected.
Starts deteriorating, doesn't it?
Exactly.
Yeah.
Just relax that foot for me.
I'm sorry.
I know, you're just trying to help me. You're so helpful. You know what? You want to come home and clean my house? I'll let you do that.
I used to do that, didn't I, Mom?
He's always been good at that, at helping out.
Aw.
Used to.
So we got a little bit on the inside here. Maybe you can pull those there we go. That's perfect. So what we're gonna do is kind of, I don't want to create, you okay?
Sorry.
That's okay. Did you feel something?
Yeah, a little sharp.
Okay. Well, I'm impressed. You could feel. Let me know if you do feel this, okay?
Yeah. No, you're fine.
So what we're gonna do is kind of freshen up the wound, and we want it to look like a steak. We wanted this red, meaty appearance, because that indicates we've got good blood flow to the wound so it can heal. So much buildup. So this is a classic pressure neuropathic diabetic ulcer. And we've got the goodies that we're going to send home with you to take care of this.
Okay,
they're getting that package, I think, together for you right now. So
awesome.
We're going to do some collagen and definitely some antimicrobial dressings.
Okay.
Yeah, that looks way better than I thought it was going to look. Okay, let's just roughen it up just a bit. Here we go.
Sorry, I'm raising my foot back up again.
No, you're fine. It's actually perfect for me right now, so
Okay.
keep it up if it's not too much trouble.
No, not at all.
All right. Get the whole
Yeah, that looks 100% better already from here.
Yeah, right.
Yeah.
So we are going to go ahead and do a little measurement here.
Okay.
What happened? There it is. That little spot right there. It measures 5 millimeters, sorry, by 6. Not bad at all. So what I'm going to do is take some betadine and some sterile gauze I have here, and then we're going to cover it up. Or you have some Amerigel there, like a wound?
Mm-hmm.
Okay, that sounds good. Yeah, and so we'll just kind of wrap it, and then I'm going to take a fresh 15 to... Perfect. So you can go ahead and get out 2 15s because I'm going to use one to trim the callus, and then we're going to do another one to get a hold of this ulcer here. Very pleased with this one. We've got good blood flow.
Good deal.
I
Yeah.
have a lot of family who are diabetic, and I have a cousin that he's got diabetic ulcers, and the worst case scenario for him. So I was telling Dad, it's like, we got to get you down there.
Yeah.
I'm glad you
thankful.
did, because these things can turn so quickly.
Right.
It really, it's just insane how it happens
Yeah.
sometimes.
He's had to have amputations.
Lesson learned. Don't neglect
So we're gonna come over here.
having this done.
Calluses? Yeah. There you go. That's a good
Yes.
shout out to our viewers
Right.
that are diabetic, and
Right.
that's the whole point of this channel. We want to learn something. How can
Have it
we?
addressed.
Yeah. Because sadly, it just goes downhill. But
Well, I'm very thankful. Very thankful.
well, I'm glad you're here.
Yeah.
Drove an hour and a half to get here.
What a blessing. Not as far as a
I can't believe that you're able to
Diagnosed.
do that much work and it's not hurting you
yeah.
because your sensitivity was gone there.
Yeah. It's just
We'll pop over
so
here.
used to the pain, I guess.
Oh no. Yeah, so this one, so pre-debridement measurement, and Katrina, let me know if you have any questions.
Mhm.
That goes that blood blister goes all the way up under that toe. So it's 4 centimeters. What appears to be 1.3. Okay, get a fresh blade here, so we're getting a lot of pressure here. Again, we don't know what we're gonna find.
Yeah.
We don't know.
Wow, does that feel better?
Does it?
It
Oh,
does.
good.
Thank you.
So that is a blood blister there. And so let's see. This almost looks like it's not attached. It's like this island of island of skin that's coming up out of this. Did you notice any bleeding in your socks or anything?
Yes.
You did, okay.
Yeah.
And then this one started, you said 2 months ago. Yeah, this one's a little, I was afraid this one wasn't going to be as good, but let's see. What lies beneath? Oh, thank you for the gauze, Katrina. May I have some, oh wait, these are, I think those are the Lumicaine ones, or maybe I spilled on there. Thank you. Okay. There we go. Lots of dead buildup. Yeah, and you had a blood blister into this one. That's why this one is.
Really?
Yes. So this may be looking like this as well. You can see how dark that is.
Oh.
That tells us it's kind of that pressure and it's been there for a while.
Oh, okay.
Okay.
Am I holding my foot okay
You're
for you?
doing great.
All right.
Are you comfortable?
Yes, ma'am.
Okay. Good deal. So, things to look for when you have an ulcer or anything like this. Number one, systemic signs of infection. Nausea, vomiting, fever, chills, diarrhea. Anything like that, you run to the
ASAP.
ER. Exactly, because that
Okay.
is a sign that it's getting into your bloodstream.
Oh, okay.
Also, another visual sign is you'll see streaking. Kind of, and it will kind
okay.
of come and it just gets larger. And so
Okay.
if you see that again, you run because that tells us it's spreading.
Gotcha.
Whittle. There we go. Okay, see it's a little darker. That maybe, I bet this is healed underneath. Yeah, I bet it's uncomfortable to have,
Oh,
you know, if
my
you can
goodness.
feel a little bit here.
Yeah.
And he had spotty neuropathy, which was interesting. I mean, not uncommon, meaning certain areas of your foot were more sensitive than
Right.
others. You couldn't feel that monofilament when we did that test.
Right.
We're also going to get you an order. So whenever this heals, oh
Right.
yeah, look at that. That's not even, oh good, that's all healed under here. Wonderful. That you get diabetic shoes.
All right.
Okay.
Awesome.
Because we got to offload these pressure points.
Yes.
We don't want to, get these healed because we have a 50% chance
Right.
of another ulcer coming back in the same area.
Oh.
So it's pretty risky. So you've got to offload.
Stay off my feet as much as possible.
Yes, sir.
Okay.
And for this one, because of the location, what I want to do, where it's really on the bottom, is put an offloading boot on. So whenever you're
Okay.
up and walking around, it's going to take off the pressure even more.
Awesome.
Yeah. So we put like a little felt piece in it
Yeah.
and just kind of customize
Okay.
and
Great.
offload it. This one, I mean, honestly, guys, I am so impressed
Awesome.
given what we were
Looking at.
looking at and what I'm looking at now. I think I'm going to have to get a fresh plate here. Another 15, please. I'm racking these up. I just don't want to contaminate and,
Right.
move. Okay.
Well, that's a huge blessing coming from you to hear that.
Well,
Thank you.
Merry early Christmas, I guess,
Yes.
right?
Very early Christmas.
Yeah, I was really happy given the length of time that
Yeah.
these were here that you did not have a bone infection.
Yes, I'm very thankful.
We're going to babysit these very closely.
Okay.
Is it a problem for you guys to drive back here in maybe like 2 weeks?
No.
No.
Okay. This is kind of, I want to get that skin there. It's driving me nuts. There we go. Maybe. And your skin is so, it's just like paper thin,
Yeah.
So we're going to work on getting that healthy and
Okay.
getting you kind of a good protective barrier once we heal these.
Okay.
Can I see a Q-tip, please? Thank you. Okay, measure the depth. Make sure there's no tunneling. Good. So tunneling is when this will go in. This is nice and solid. I'm getting a firm kind of a base to it, but the depth is 5 millimeters. So that is a little deeper. So definitely deeper than the other one.
Yes.
So that's why we definitely want to take the pressure off of this. And it's right underneath the head of a bone.
Okay.
Yeah. Let me grab a little corner here to get this rim. You feel that?
Yeah, a little bit.
You do? Okay. So I would say this is a pressure wound more so than a neuropathic wound.
You're fine.
Okay. And if I need to stop and take a little
No,
break, you
you're
just let me
fine.
know.
No problem.
Just want to get this rim right here. How sensitive is it?
Just that little poke.
Just that little poke?
Yeah, but it's good now. It's not very filling.
Good.
That's the one that kept the old man up at night.
Oh, yeah?
Yeah.
So how long have you been losing sleep over this?
Probably
This just doesn't want to come off.
3-4 months or maybe a little longer.
What? This is, you've not been sleeping because of this
Yes, very painful.
for 3 to 4 months?
It pulled my foot up off the bed.
I thought this one was here for 2 months and this one was 4 months.
No.
Are they reversed?
Yes.
Ooh.
Just the callus part was there for 4 months.
Okay.
On the side, mostly.
Yes.
It was on the side. But then the bleeding on that came about like in the last month or two. Yeah.
Okay, got it. That makes sense. So this one is and I'll get you the post-debridement, the mixed fibrotic granular base. This one isn't bleeding as much, and I know I didn't nick him like I did the last one, but I kind of want to just to get some blood flow there. So it's 5 by 1. Okay, I'm gonna go ahead and trim this callus up too. I can probably just do with that. And then we called in a good thick cream
Oh, okay.
for you to put on your feet. I'd say twice a day,
Okay.
just because they're so dry and it makes it, like I said, just kind of like paper thin.
Yeah. We'll put it on a couple times a day.
Yes.
Okay.
And not to the wounds. They're gonna bring in that kit and kind of show you how to use
Okay.
all of this.
Great.
And then we'll get this last one wrapped up in just a couple minutes.
Okay.
And let's go ahead and trim your toenails too while we're at it. Thank you. We will get our toe band. I'll take some fresh gloves, Katrina, please. And I can't wait to get your skin in better condition.
Yes.
We'll have to put a little bit more in just a few minutes. Okay, round 2, toenails.
Okay.
When's the last time they were trimmed?
Been a while.
Been a while?
Yeah.
That's all right, I got you. So what I'm going to do is just get the length and really kind of get as much of the nail as I can.
Okay.
And then they're going to come in with a Dremel to smooth them down and buff them down.
Okay.
Do you want to start over here or here?
It doesn't.
Okay.
Oh, okay.
You say her, whatever's easier. So, yeah, whatever view you need to get.
Whatever you think.
It's amazing to me how many people find, trimming toenails and calluses is soothing and relaxing.
Yes.
We have a lot of people just watch it too. But I guess I'm guilty. I play Candy Crush
Oh.
to relax. Okay. Get a little bit here. Some of it, they're just kind of a little jagged.
Yeah.
Did somebody try to trim them?
I did.
Okay.
Not recently, but it's been a while.
Okay. That makes sense.
Yeah.
You didn't do a bad job. I could just tell.
The big toes always been like that, both of them. As far as coloration of them.
Real thick.
Were you pretty active when you were,
Yeah.
Yeah.
When I was younger.
Mm-hmm.
Yes.
I'm gonna drop this down just a little bit so I can see a
Okay.
little better. Yeah, and where they're so thick, it's really hard to trim. So Diabetics are definitely not recommended to trim their nails,
Oh,
especially with a risk level like this,
right,
meaning, you've got that spotty neuropathy.
right.
You do have good circulation, which I'm really happy about.
Yes.
Over here. Okay. You're gonna feel like a new man walking out
Yeah,
of here
yeah.
today.
They wanted to sing in the rain or something. Maybe we'll dance it in the parking lot.
I can't wait for you to come back because I want to see these. I would say they'll probably close up. The right one will close up probably about 2 weeks.
Yeah,
The left one's going to take a little bit longer. Where it's got
Okay.
that fibrotic base, that white appearance,
right.
it has a harder time healing.
Now, do you want me to put the cream right over where you had taken it off?
No, we're gonna show you
Oh,
that
that's
little,
right.
that
That's right.
package. That's for just all the skin,
Okay.
away from the wounds, but all of the skin.
Okay.
Yeah, then, oops, roll over.
Well,
Probably
I've been
toenail.
so blessed today on this visit. I hope what we're doing today helps someone else.
Oh, thank you.
Yes,
I do too.
I really do. I mean, it's unfortunate I had to be the one to do that, but I'm thankful that it could possibly help someone else
Yes,
or
absolutely.
other people.
Your poor little nails are like trimming rocks. I don't
Yeah.
see how you could have done this.
No.
There's no way. I mean, I'm having a hard time. Okay, it's almost time to get the cleanup crew to detail this. Yeah, these are brittle. Oof. Okay, we're gonna smooth that guy down. All right. Well, we are going to show you how to take care of them on a daily basis.
Okay.
Kind of re-rack this one, get it all fixed up.
Okay.
And then we're gonna offload this one with a boot.
Good deal.
Yeah, so we're gonna put felt on the interior of it so we can float the bone. So there's 5 bones called metatarsals on the bottom of the foot. The 4th one is picking up pressure. So we know that that bone is plantar flexed or coming down,
Right.
and it creates a pressure point. You don't have good feelings, so the skin just breaks down.
Right.
So what we want to do is offload that bone, and so it's no longer a pressure point.
Awesome.
And so that's what is also going to happen with your diabetic shoes too.
Good
We're
deal.
not going to do those until this is healed though.
Okay. Good deal.
All right, guys. Well, I hope you learned something today. If you have any comments, please drop them below. Don't forget, ring the bell, sign up for the channel. I'll see you next time. All right. I know on the first ulcer, there was a little nick. So before y'all bash me, it happens. This is podiatry. The goal is there's blood flow there. That one's going to heal up pretty quick. Little concern on the second one, just because of the depth of it and that fibrotic tissue. But the goal is to watch him very closely, and we really want to kind of eat away at that tissue. And now that all that necrotic tissue is out of the way, he's got a good chance of healing that up. Little concerning about the pain for this long. However, I don't know if that's coming from his neuropathy, because that could be a possibility, especially at night. And he said his leg jerked, so kind of keep that in mind. All right, just wanted to give you that little tidbit.